Assalamualaikum warahmatullahi wabarakatuh. Good morning everyone. For you coming today, my 11/2020 at 10 p.m. and Bonatu, we will done nursing round. Before we begin, let's pray together. Pray begin. Done. Next, we have Dr. Abian as the main doctor, Miss Mailia, a pharmacy, Nurse Talia as a primary nurse 1, Nurse Olivia as a primary nurse 2, and Nurse Firda as an associate nurse 1, and Nurse Teguh as an associate nurse 2. In this morning round, Nurse Talia is primary nurse 1 will present the case. Our patient today is baby Mr. I, 3 months old, BPJS class 3, was diagnosed with hydrocephalus plus abscess cerebri. The length of stay is 20 days with an unsolved problem is ineffective breathing pattern and rest ineffective of brain tissue perfusion. Our goal is this round is to discuss the best problem solving is this patient. Next, please Nurse Talia to present baby Mrs. Aikis.
Thank you, Nurse Enda, and thank you for all who come today. My name is Talia as a primary nurse 1, and in this time I will present the case of baby Mrs. I as our managed patients, and I will report to you the condition of our patients. And that's all about the explanation of our patient who unsolved problems and the intervention we have given. I hope everyone in here can give the advice to improve the condition of our patients. Thank you.
Thank you, Mrs. Talia, for the presentation of the case baby Mrs. 1, which has been presented well. Is there any clarification from associate nurse 1 and opinion from primary nurse 2?
No, nurse, enough.
You, Nurse Enda, I'd like to argue about patient with ineffective breathing pattern and with ineffective of brain tissue perfusion nursing problem. In my experience, in treating patient, we must be able to know the cause and will provide appropriate intervention from the etiology of management in a journal that I have read. That is rarely by temporary therapy or shunt surgery. Temporary therapy in the form of the conservative medical therapy with the intention to reduce fluid from the choroid or exhaust, and is given only temporarily or short term because of the risk of causing metabolic disorder. We can also do shunt operation internally or externally. Internal shunt placement are usually directed to the right atrium of the heart or peritoneal. Externally where installation, the risk of causing infection.
Okay, thank you, Mrs. Olivia. Nurse Olivia, does anyone want to argue again? If no one argue anymore, then we can continue validation the patient to clarify of detail. Let's go to be back C5, Nurse Firda. You can prepare to require instrument and date.
Ms. Firda, please prepare the instrument, status, and patient data.
Yes, nurse.
Good morning. Would baby well this morning, Mom? Is there a problem?
Good morning, nurse. He always cry and the head get bigger.
Alright, Mrs. I, as promised, we will carry out a nursing round to make the right plan and the best intervention to solve the problem. Daya, Dr. Abian is the main doctor. Miss Maelia is a pharmacy. Nastalia, a primary nurse 1. Nurse Olivia, as primary nurse 2. Please validate the patient.
Good morning, Mrs. I. How's the baby's condition? Is there any complaint? Do he still feel breathless and the head gets bigger?
Good morning, nurse. He still feel breathless and I see the head get bigger every day.
Can I do a physical examination of the breathing and his head?
Yes, please. Has he reserved observation of GCS, vital sign, lab observation, and EWS score?
Yes, it's 8 o'clock in the morning. I did a vital check, GCS, and observing the result of the lab, especially white blood cell. The result of physical examination on the client appear enlargement of the head. The client's vital signs: pulse 140 times per minute, temperature 46.8, respiration rate 39 stems per minute, early warning score 0, no retraction of the chest wall, no nasal bleeding, GCS E4 V5 M5, head hydrocephalus and white blood cell, 60X and 10 cerebral abscess.
Alright, we are done for validation. Let's go back to the room to evaluate and determine the next treatment. Alright, after we do the validation, next I invite Ms. Talia to explain the examination result from baby Mrs. I.
Yes, nurse. I will read the report related to the condition of baby Mrs. I. Mrs. I says his baby still having a shortness breath. There appears to be no chest retraction and nasal breathing and respiration rate 19x per minute. So the diagnosis of ineffective breathing patterns can be drawn. The client also looks enlarged head every day. WBC obtained 6, 8, 10 or 3.8 until 10.6 x 130 per microliter. So that nursing problems can be drawn the risks of imbalance of brain tissue perfusions. Then for vital signs, pulse 140 x per minute and temperature 36.8 degrees Celsius.
Well, we can conclude the patient nursing problem is an effective problem patient and risk ineffective of brain tissue perfusion with style not resolved. Next, I invite doctor and pharmacy to provide clarification and recommendation that we can document and apply to patient.
Okay, thank you for your time. And my recommendation is conservative temporary therapy, which is used for reduce choroid alexus fluid using acetazolamide 100 mg per kilogram body weight per day and furosemide 0.1 mg per kilogram body weight per day, and given for short term only because of the risk causing metabolic disorder. And you can also doing some operation internally or externally, but don't forget to take care for the infection risk. And the last regarding for acid test, we are still evaluating by observe the white blood cell volume, and that is my recommendation. Thank you.
Thanks for the opportunity. The administration of drug obtained by Mrs. I is also still following the doctor's advice. Currently, patients are still getting intravenous dextrose 30%, 157.5, and metronidazole 35 mg per 8 hours. Patients also get medicine in the form of injection and oral. For further drug, just follow the doctor's advice while waiting for change from the patient condition.
Thank you the feedback given by doctor, nutrition and pharmacy. As the any question, if the agent invite Mrs. Talia and nursing Firda to read back all the intervention and recommendation.
Well, I will conclude from the result of discussion this morning. The nursing implementation that we can take to solve the problem for the ineffective of breath patterns and the risk of ineffective of brain tissue perfusion that is by recommending AFSAN, plasmon and fluid retraction to reduce hydrocephalus, and administering drug according to doctor's advice while monitoring the patient condition every day.
Is the any addition?
No nurse enough.
Alright, for primary nurse 1 and primary nurse 2, please do all the intervention and recommendation that we have plans for each shift. If there is a problem, you can report with me or the nursing round team.
Yes, nurse.
Yes, nurse.
Okay, let's end this nursing round. I hope everything we have planned will be useful to patient, and thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.